Now, tell me about developing your company, TeamWorks. How did that all happen?
So it was about a year and a half ago, we we started to look at what we were looking for my practice was I wanted a consistent visual patient education program to repeat the same message over and over. Because like we said earlier, the real conversations happen when we're not in the room, and the patient has to hear it five, sometimes a lot of times before they really understand what they need. And I didn't see it out there, and that's when we started to develop it. So we started to make 3D 4K type videos of dental procedures where you show the problem and then let TeamWorx show the solution. And we called it TeamWorx is because it's all about team and it's all about the workflow. And that's the staff has to support your dentistry. And you're only as strong as your least confident employee. And we wanted to provide a solution where hit play, and any staff member, whether at the front or the back, they have the ability to confidently show the patient what they need and why they need it. And we don't have the luxury of being a physician's office. If a patient calls in, you can't press 2 to talk to a nurse. If a patient calls, they're expecting to talk to somebody clinical. And we hear this all the time. Why do I need the deep cleaning? Why does my husband need the deep cleaning? Why can't I have a filling instead of a crown? And we wanted to provide, and even though the patient may seem like they're challenging you, I think they're really just trying to know, like, why. And we want to provide that visually. We live in a visual world with social media, and it's all about video content everywhere. And we wanted to bring that to dentistry.
Now, are these videos to be shown in the hygiene room, the dental chair, the treatment plan room, or is it really for anywhere to show a patient?
Great question. We wanted to provide a touch point for any part of the journey. So chair side, 100%. Treatment coordinator room, 100%. We provide it for active subscribers. We provide the embed code so you can put videos on your website. And then we also provide a textable link. So if a patient needs to go home, talk to their significant other, we provide a link where you can put in your patient engagement software to text to them. So we want our video and our content, TeamWorx, to live anywhere where the patient is. Every point of the patient journey is really important to us.
And you have a broad range of videos, for example, hygiene, crowns, fillings, implants.
We go from hygiene all the way to specialized oral surgery. We have clear aligners. We have stages of gum disease, scaling and root planing. We have sinus lift. Our full arch is coming this week. We have crown. We have cavity, cracked tooth, implant, bone graft. We have 75 videos, and it's growing every day. And our average length is about 40 seconds. Our longest one is around a little over a minute because we show a root canal through a crown. Isn't that a fun thing to talk about when patient needs a crown? What do you mean? You got to take my crown off now? What the heck? Or how does this work? No, you can go through the crown and we can fix it. And so that's one of my favorite videos, actually, because that was always a tough thing to talk about. But we try to keep it quick, just shorter attention span. We know that. And we really want to give a journey to show the patient this is how it's going to be. And that will lower stress. And if you can make the patient feel that they have some control, patient acceptance, treatment acceptance is going to go up.
Yeah. And I think that, a picture is worth 1,000 words, but a video is worth, 10,000 words. I've gotten better. I've been practicing for 20 years, so I've gotten much better at explaining and knowing what key words to use to get patients to move forward with treatment. But as a young dentist, I was not good at that.
Right.
And I would explain procedures and have a difficult time. And I could just tell sometimes that patients weren't, locking into what I was saying. So having a video there to show the patient, I think is so valuable.
Couldn't agree more. And we have reporting that comes along with TeamWorx where you could see which staff member is playing which videos. We're even adding a leaderboard so you can see who's playing the most videos. We're really trying to make it a fun thing to do because it should be. Talking about treatment, you can solve the patient's problem, and you should be able to involve that patient on their journey, and there's no better way to feel like they're involved than a picture. You're exactly right, Eric.
Yeah. And, by the end of the day, I'm exhausted, and having to explain the same procedure over and over and over again, it's tiring, and I'm probably not going to do as good of a job as I did at 8 a.m. So what better than to pop on a video and, have the patient watch it, or if it's in the hygiene room, um, put the video on while the hygienist is going to get the doctor for the exam. There's so many ways you can use it to help you in your practice, correct?
Yeah, 100%. It's time and energy, like you've said. It is, talking about treatment, like what is this crack that you have to fix? You're talking, stop talking, start showing. And the workflow is important to us because we built a Chrome extension that is a one-click access to the library. And because at the end of the day, we all know you can put the best product into the workflow. If it is not easy to use, if there's a separate login and they got to click 10 times to get somewhere, it's not going to get used. And the Chrome extension was important to us because it is a direct link to the library of our videos all day.